Welcome to My Spoonie Sisters, featuring stories from special guests dedicated to empowering those with chronic illness. Our goal? To connect people and provide the support and tools they need to live a better life. For those with chronic illness, our energy levels just fade faster. We must be more purposeful with the spoons allotted to us. So grab your coffee or tea, sister, and tune in as My Spoonie Sisters share stories of living with chronic illness. Hi, my Spoonie Sisters. I am your host, Gracefully Jen, and I, once again, as I always say, I have the pleasure of bringing to you another amazing Spoonie Sister. Welcome, Makenzie. How are you today?
Hi, how are you? I'm good.
I'm doing okay. You were just telling me a second ago you've had some flash flood warnings. What's going on over there?
It's a disaster. Right where we're at, it's like okay, but more downstate, people are losing their houses, roads are disappearing, it's like landslides. It's so crazy. Luckily, we're kind of in the clear, but it's still raining all day.
And for listeners, you're over in New York State.
Yes.
Up near the Canadian border. And I think I saw someone else recently this morning. They were saying something about they were going to go to a concert over the weekend, but they used their better judgment to stay home. And they were so glad they did because there were roads washed out.
I couldn't even imagine being on the road right now. I don't know.
Yeah, I'm not all about that. I would rather stay home and hide.
Right?
All right, so enough about our banter, but we are here to highlight and talk about you and your family. And so do you mind kind of just giving us a little bit of an introduction to about you and why I brought you here?
Sure. So I'm Makenzie. I'm 22. I am a registered nursing student. I want to work in rheumatology and rare diseases when I'm done. I was diagnosed with JIA, which is Juvenile Idiopathic Arthritis, when I was 13 after having so many different crazy symptoms and, that whole gaslighting stuff, which is unfortunate for a little girl. My son, Josiah, also has a rare autoinflammatory disease, Familial Cold Autoinflammatory Syndrome. So it's like two of us in the house. And then Jace, my 4-year-old, he has thalassemia and a blood platelet coagulation defect disorder, which is his platelets don't work correctly. So he gets iron infusions monthly. And then I'm also married to my high school sweetheart. We've been together for like 8 years.
And does he have anything?
No, just anxiety. I'm like, great. We're all sick besides you.
Hey, that's great, right?
He doesn't get it.
I'm sure he tries, right? They try their best.
Yeah, that's very true. I mean, it's hard because his parents and his family's from the Dominican Republic. So the whole medical stuff is very taboo. They don't like talking about it. So him going from that to a family full of doctors, nurses, healthcare professionals, he's like, why are we talking about it like this? He's not used to it.
Oh, wow. Well, he's in for a long road of getting used to it and hopefully catching on.
For sure.
Okay, so I was diagnosed when I was 32. So 13, that is way different.
Yep.
So I guess what got you to the point where you needed to be seen to figure out what was going on with you? What were kind of some symptoms that were going on in the beginning?
Yeah, so my mom, she actually has lupus and she has rheumatoid arthritis plus some other things. Like she's like really sick all the time with like autoimmune stuff, but she also has thalassemia like my son. So I was pretty much showing the same characteristics as what my mom was, and she wanted to get a hold of it quick because she wasn't diagnosed till she was about 27 to 30-ish, that time frame, which by then she was so sick. So it took them years of getting her back to what her normal is, which is not normal. So doctors pretty much told my mom, hey, like your kid is just depressed. There's nothing wrong with her. And blood work was abnormal and they still wasn't listening. There was times where I couldn't even walk on my legs or go to school. And my mom's like, absolutely not. No way. There's something wrong with my kid. Like she has a long history of like autoimmune stuff, a whole bunch of family members with autoimmune stuff. So it took them a long time, but we finally got the diagnosis after going to so many different places. It was a long journey.
I can't even wrap my head around that one. So, okay, so you're finally diagnosed at 13. What did that look like? Did they begin treatments for you? And I guess words
They
are not
told me
working for me.
it's a lot because back then, even before my time, all these autoinflammatory diseases aren't taught in school. Even for me, I had to bring up to my professors, why aren't we learning about these rare diseases, supposedly? And they didn't know what to do when they diagnosed me with JIA. They're like, well, have a healthy diet and exercise. No, I need to be on some type of medication. So they had me on like the Humira injections for a while till insurance decided to not cover them anymore. So now like we're managing with infusions. I get like iron infusions because I'm also anemic, which helps a lot with my symptoms, but also just Tylenol and Motrin, which sucks. And then I get prednisone, which makes me gain weight, and I hate it.
We've all been there.
Yeah.
Oh my gosh, don't even get me started.
Ugh, it's so frustrating. I hate it. It's sad that a lot of people have to go through this and doctors don't have the knowledge. Like even for my son Josiah, he's on a biological interleukin injection for Alaris, and they still don't know about his rare disease. And it's like they're guessing, I think, and it's sad because he's 2.
Yeah, that. Sorry, my husband was trying to call. I'm trying to text him and tell him that I can't be bothered right now. Okay, so I mean, I'm trying to figure out how we can talk about both you and your children going back and forth. So we're gonna
Mhm.
take a pause because you're okay. So first child's born. Did you notice anything right away?
Well, with Jace, he was the typical normal baby, but he bruised a lot. And, when kids are bruising a lot, automatically they think they're getting. So I had to fight them and be like, hey, I have a blood disorder. So does my mom and my grandma. Why don't we check him? And they never did, even though he was anemic for 2 years of life. They were just like, he's fine. He's going to be okay. It's the formula. And I'm like, absolutely not. So then I got pregnant again, and like I was like, okay, we're gonna feed him iron. He's getting iron drops. Maybe he'll be better. Because now I'm worried about another pregnancy, which I had HELLP syndrome. I almost died with Josiah, and then Jace was getting worse at this time. So like having a sick newborn, sick 2-year-old, and then I was sick. So I was like, we got to figure this out. So we all went to the hematologist at the same time, and that's when they diagnosed Jace with all this blood stuff. I'm like, wow, if we caught this 2 years ago, he would be better because now he has bruises all over his body and he bleeds everywhere all the time. Like seriously. So it was just the last couple of years have been ridiculous.
Yeah, like how about you listen to me? I know what I'm talking about. There's something not right.
Yeah.
And for listeners, you and I have chatted a little bit about this. I'm going to
Mm-hmm.
mind blank on the movie we were talking about. What is it called? Do you remember?
I don't remember.
This is like the worst time for me to have a mind blank because I want to tell people about it. I cried so hard through the whole movie because it breaks my heart to think of any parent and any
Oh,
mother going through what they went
take
through.
care of Maya.
Can you say that again? I'm sorry.
Take care of Maya.
That's what it was. Yes. Okay. So, people, I'm telling you, take some tissues if you're like me.
Horrible
Go
movie.
watch that movie because I'm serious. I feel like a lot of parents go through this and it's not talked about enough.
It's it's sad because people automatically think you're abusing your kid or you have Munchausen by proxy. That's what they said about Josiah when I was bringing him into the ER every week with something. And they're like, "Are you doing this to your kid? Because why are you here every week?" I'm like, "No, there's something wrong with him. Hello." Like you're not listening to me. And they just portrayed me to be like this crazy psychopathic mom. I'm like, why would I do this to my kid? I work, I go to school. I don't have time to be at a hospital every week. I'm not doing it for attention. And then one day they're like, oh, you're not crazy. Your son has a rare disease. I'm like, great after you accused me for 2 years, like, till
Yeah. Can I have my apology now, please?
right?
Oh my gosh. Okay, so back to you again. I know I'm going to be all over the place, people. I'm sorry. But what does your treatment plan look like now?
So right now I am hooked up to an IV pole 8 out of 12 months. I get iron every single week religiously for 3 hours. That kind of helps, but not really. I take prednisone. I take Fioricet for my migraines I get with my flare-ups, Tylenol. Um, I'm trying to get back on my Humira injection, but insurance doesn't like to cover anything these days. So it's just pretty much these little medications here and there, trying to stay active, have a healthy diet with like no dairy, no gluten, all this crazy stuff that they say it's an autoinflammatory diet. It's like eating nothing. And then getting realistically 3 hours of sleep.
Oh my gosh. Yeah, absolutely. So they don't even have you on like a DMARD or anything either?
Mm-mm. No, because they said it's because I'm 22. I should still try to figure out like healthy, holistic ways and have minimal medication. I'm like, when I can't walk, I still have to take care of my kids. That's like a problem to me, but nobody listens.
And this is a rheumatologist, right?
Yep,
That's lovely. Because, I mean, I guess in my mind, especially with the rheumatologist I have, you want to slow down the progression of the disease.
exactly.
So being diagnosed at 13 and kind of not really treating it very well,
Hmm.
eventually you're going to be like some of these young people we know that have had knee replacements and stuff like that. And that's the last thing you need on your plate.
Yeah, and that's what I say. Like I had a hip surgery at almost a year old because my joints and my bones were so like weak already. They actually broke doing like the reflexes that they do with all newborns, seeing like your body parts and stuff like that. So I in a as a spica cast for almost a whole year, and now one of my legs is about 2 inches longer than the other one, which messes up my gait anyway. So I have more pain in my legs, and then my bones already have like arthritis, like in my hands, my feet, my ankles, my hips. So I'm like, why aren't you helping me? I'm only 22. I don't want to be in a wheelchair when I'm 40. Like, hello.
Absolutely. Absolutely. Okay, so dumb question, but does going to a chiropractor help at all with the gait issue?
So I tried the chiropractor and I feel like it makes my pain worse. I like done physical therapy. I've tried like the aqua, like swimming therapy. It's just everything hurts, especially when you're moving around. But then you hurt when you're laying in bed all day. So it's like lose lose. You're hurting all the time.
It's a matter of finding that middle ground. Like, what doesn't hurt the most?
I hate
And
that we that way.
yeah, I tried the aqua therapy for a while. And I was in my 30s, my kids were in middle school. I mean, you're the same age as one of my kids.
Mhm.
So, going to the gym and doing this aqua therapy while my kids are off playing and having fun, and I'm with all the old ladies. Yeah, that was super fun. And they're all looking at me like, why are you here? Are you pregnant? Like, what's the deal? No, I'm just trying to do something to be active. And,
Yep.
yeah.
Yeah, I'm 22, and everybody's like, "You shouldn't be in pain. You're only 22." I'm like, arthritis goes in every form. My kid is 2 years old and has arthritis. Like, kids can get arthritis too. Hello, and then everybody like makes fun of me because I play on a co-ed softball team, and they're all older adults, like 40s, 50s, sometimes 60s, and they're like, you're fine. You're fine. I don't have arthritis. I'm 60 years old. I'm like, well, guess what? I'm 22 and have arthritis, so mind your business. Okay, how about that?
People just don't get it. They just don't.
My wife.
And okay, so your Humira, you did injections. You didn't go to your rheumatologist for infusions.
No, I had to go through the hematologist for infusions because the rheumatologist, I feel like around our area, since it's not a rural area, but it's a small town, so the doctors don't really listen because I feel like they're not knowledgeable enough on these type of things. It's unfortunate, and I don't have the means to drive 12 hours to a good rheumatologist yet.
Yeah, I hear you. You know, where I moved now, I technically am rural, but I also, if I drive 30, 40 minutes, I can be in Vancouver, Portland, or I can drive an hour and a half or two and be in Seattle. But I drive 4 hours just to go back to the rheumatologist I had before I moved here because I don't want to start over.
Yeah, it's hard starting over when you move. Nobody thinks about that. Like military people just say they have to PCS every 4 years. And if somebody has an autoimmune or autoinflammatory disease, they have to find a doctor every 4 years. I'm like, that couldn't be me. No, thank you.
No, no, especially because you never know what they're going to be like.
Yeah,
And so if you get a good one, try to do what I'm doing. Go virtually as often as you can, and then make it one time in person a year.
that's what we do with Josiah's rheumatologist because she's 2 hours away. And we do virtual every, I would say, 2 months. And then at the 6 month mark, we have to go see her twice a year, which I mean, it consumes gas, but we try to make like a day of it. Like we'll go like to the zoo or something, make it worth it pretty much.
Absolutely. I mean, that's exactly what I'm doing. I still have family and friends over where I used to live. And so to me, it's like, okay, well, I'm going to make a trip out of it. I'll stay a whole
Yeah.
weekend or whatever, take my husband along. You might as well.
Yeah,
And then it probably lightens the mood for your children too, because then they're looking forward to it as, oh, I get the zoo day and all these fun things. And
exactly.
so that's good. Well, I just commend you for all that you do, and I think it's wonderful that your children have a mother that understands.
Yeah.
You're going to be able to help walk them through this journey as tough as it is because you get it.
Yeah, and it's hard. I couldn't imagine like coming from parents or like family members who don't know. Like I couldn't imagine like my husband being sick like I am and then having a family who's like judgmental and they don't listen or they don't care or they don't want to talk about it because then it makes you suffer and then it's like a cycle, like a generational thing. Then your kids feel it and it's like, ugh, I I don't want that for my kids.
Absolutely. So looking back, what do you wish you'd known at the beginning of all of this? I mean, granted, you were young, but is there anything you wish you would have known?
I wish I stood up for myself more. Like, granted, I was a minor. My mom did most of the work, but I wish I had the voice that I do now. Because, I mean, 13, you're still becoming a teenager. Because I feel like a lot of 13-year-olds these days, at least, definitely are very outspoken and disrespectful. But not meaning that I wanted to be disrespectful, but just stand up for myself because I would tell my mom things and then my mom would tell them. I wish I did it myself because maybe it would have been different coming from the patient and not like the caregiver per se.
Calling all Spoonies. As a host of a chronic illness podcast, nothing lights up my day more than hearing from you, our incredible listeners. Whether it's a topic close to your heart that you want us to uncover, or you are keen to show your own journey as a guest on our show, your voice matters. Living with chronic illness can often feel isolating, but through the power of podcasting, we can come together as a community to uplift, educate, and inspire one another. Your stories, insights, and questions drive the conversations we have and the topics we explore. So if there's something on your mind, a story that you are just itching to share, or a guest you'd love to hear from, don't hesitate to reach out. Your voice is not only welcomed here, but celebrated. Let's continue to amplify the voices of those living with chronic illnesses and create a space where everyone feels heard, supported, and empowered. Together, we are stronger. I'm just so lucky. I'm so lucky. I'm so happy. There's the word that your mom was able to advocate for you and just really fight for you because she got it. That's
Yeah.
great. Because not a lot of children have that. And sometimes a lot of parents are like, well, it's growing pains or it's this or it's that. And that's not always the case. And okay, example. So I have a daughter that is 23. And all through middle school and high school, she was always having wrist pains and all kinds of miscellaneous aches and pains, right? And she did volleyball, she did track, and we didn't think anything of it. She didn't think anything of it. And then after her pregnancy, all these blood markers started coming back. She finally told the doctor, like, look, I'm having hip pain, hip problems. And they came back and sent her to my rheumatologist.
Mm-hmm.
She doesn't have RA, but she does have some autoinflammatory issues going on. we had no idea. And she had a mom with RA. But
Yeah.
I mean, honestly, it seemed like, okay, well, maybe, maybe she was throwing the ball wrong or whatever. I mean, even she thought that, we thought that. It was, ugh.
Yeah.
So,
And that's a big thing. And that's why, like, I want to be a rheumatologist nurse practitioner, because I believe that if you come from a family history, or even one person, like just say like your grandma and it skipped your mom, they should automatically be tested like for autoinflammatory and autoimmune markers at birth. I feel like it could cause so many good research things and then less suffering for kids, because I suffered for 13 years. Like, that's not fair.
well, and even if you're not showing signs and symptoms yet, at least they know what to watch out for.
Exactly. I agree.
And oh my gosh. Okay. So next question for you. Your Spoonie toolkit. What are the top 5 things that are in your Spoonie toolkit?
That's a good question. Definitely, I like food. Food is one. Food is comfort. Medication, like sleeping in bed, my bed with my like Tempur-Pedic pillow, because I that, and then just like support from all you, like you guys, like the groups that I'm in, and then my kids, because my kids make me warm inside.
I love it. That is a great toolkit. I love it. Okay, so tips and encouragement. Do you have any advice or even mindset tips for people in a similar journey to yours?
Just be strong. I mean, there's nights where I cried in pain. Like a couple weeks ago, I was in a bad flare up. I thought I tore my rotator cuff. I could not move. I was like propped up on my recliner crying. I was like, "What's wrong with you?" And I'm just like, "I'm just in so much pain. I just want to go to the ER." But going to the ER, they're not going to do anything for you. They're just going to be like, "You're fine. Go home. Take some Tylenol." So it's like, just be strong. You're going to get through it. Like, just hold on. That's what I tell myself. Like, just make it one more day. Like, just, you'll be okay.
Take those baby steps
Yeah,
because hopefully, how I feel today, I am not going to feel tomorrow.
exactly. Like, it's gonna be all right. Like, unfortunately, all of us in this group feel the same way. It's sad that it comes down to that, but we have each other to lean on pretty much. Just vent to somebody.
I love that. I love the fact that we can just easily get online and I can be like, oh my gosh, Makenzie, this is what I did yesterday. What the heck? Any tips for me today?
Right?
Or just vent. We can vent.
Exactly. Or even advice like, I need help with this doctor. My doctor is saying this. Or do you have any new like auto-inflammatory diet recipes? So I'm always asking people for new recipes for me and the kids.
Oh, yeah. Oh my gosh, definitely. And I came across an account. I'll have to try to find it and send it to you. There's something I'm going to try to make this week. It's definitely not AIP, but it looks amazing. And it basically is like an ice cube tray. You drizzle some chocolate in the bottom, put some peanut butter and some peanuts, and then mash up raspberries.
Well, that sounds good.
And when it's done, you have these like little ice cube shaped delicious treats.
Oh, that sounds so good. I
I
have to.
know. I saved it last week and I'm like, ooh, I've got to try this. But I've been waiting for my daughter to get here and she's not getting here till Friday. So maybe I'll make them Thursday.
Thursday.
I have to, I have to try it first, right? Okay, so, okay, staying positive. How do you maintain a positive outlook despite the challenges that you face?
It's hard. I'm not gonna lie. I'm such a pessimistic person. I am so negative all the time. I'm not even gonna lie. And my husband hates that because he's so like happy. And I'm like, because you don't get it. You're not in pain all the time. You can be happy. You're not living like me. But then he's just like, listen, you have 2 kids. You could be like starving right now somewhere in a third world country. I'm like, all right, you're right. Like, let me stop. So it's just think about it, like there's someone always going through something worse than you, and you just need to just suck it up and be like, this is my life, these are the cards that I got dealt to. Like, just, it is what it is, just got to deal with it and be happy. And it's hard, I'm not gonna lie. Like, I'm not gonna be like, oh, I'm a great happy person all the time, because I am not. I am miserable, and I feel like it can rub on your kids, so try to hide it.
Try to hide it the best you can. Let it slip out to the people you need to. Vent the best you can when you need to. I mean, all the things.
Or I go to therapy. I go to therapy twice a week. And I can definitely tell you, my therapist should get paid more because I go in there screaming sometimes on how miserable I am. But then and I'm 100 times better and I just want Taco Bell. So
I feel like if I still went to therapy, I'd want to just lay on the floor and be like, okay, heal me. Can you heal
right.
me today? Just heal me.
That's how I am. I'm like, why is this just gonna stop? Like, I'm 22 and I am probably gonna live like to 100. My luck.
Yeah. I don't know about you, but the genetics in my family, they freaking die old.
Ugh.
I had a great grandma with RA, a a grandma with arthritis issues. I mean, you name it. They all lived to be in their 90s. I'm going to be old. I'm going to be old and miserable. So I got to find a way to just get there and be old and miserable.
That is so funny.
All right. So let's talk a little bit more about your kids.
Okay.
I'm not sure really what to ask just because I'm not completely familiar with what you're dealing with, but what do you
So
want to tell me?
they both have autism. I mean, Jace, it took him till he was 4 to start talking. Now he doesn't stop talking. And it's like, great. Like, now it's the total opposite. You'll talk people's ear off all day. But I love it because he came from being nonverbal to overly verbal. So I'm like, great. Okay, at least you can express what you want. Josiah, he is nonverbal. And they think part of it is because he has autism. But with his rare disease, some kids go deaf, and he failed all his hearing tests so far, and we actually just met with an audiologist and are thinking about hearing aids in the future already. So I'm like, great. So maybe once we get his ear stuff situated, he will automatically start talking, which that would be wonderful because he can't regulate his emotions right now. What else? Jace has the blood disorder, and Josiah has a rare disease, which it's hard to manage, but we're figuring it out. I mean, we have a little group. I think there's 10 of us in the US, but everywhere else is international. So it's nice to connect with families all over the globe.
Oh, absolutely. And you guys can give each other not only support and venting, but tips and advice on different things that people are trying or who to talk to. And
Yeah,
that's fabulous. Those are
it's
important things to have.
it's awesome, but it's sad at the same time because you still feel alone. Like, we're the only one in New York so far with this diagnosis, and they don't know how to treat it. They pulled out like a from 80 years ago, and they're like, here you go, this is his diagnosis. And I was like, okay, so you're telling me this book, it says that my kid can have kidney failure, be deaf, blind, in a wheelchair, arthritis. But now you're telling me, well, medical stuff has advanced. There's chances that he won't have this. So what is it? You're confused as a mom going through this for the first time. And they don't know what to say. And they just like, well, if you have any knowledge, just or literature, bring it in. I'm like, great. I feel alone here.
It's almost like, okay, I think you're trying to do your best, but maybe you need to recommend I see someone else.
Yep.
And that's okay. If they don't know the answer, it's okay for them to refer you to someone else.
Yeah, it's right now we are trying to get him into the Mount Sinai Clinic in New York City, but it's hard because insurance doesn't always cover everything. And I'm like, so I'm gonna bet thousands of dollars, but I would do anything for my kids. So it is what it is.
I wonder if there's any kind of programs or assistance of some
Yeah,
sort.
I have to look into it. We've been trying to reach out to so many different rheumatologists, like in Philly, New York City, Boston, and unfortunately, all these good rheumatologists have long wait, and nobody talks about the wait list. My kid's gonna be 10 years old by the time he gets in, so it sucks.
Okay, I'm going to put a plug in right here. If anyone has any knowledge and information that can help, please reach out to Makenzie or myself if you need to. Let's get Makenzie the help that they need for their children. Okay? Let's do it. Let's do it right now.
It's frustrating. It is, but he's such a happy boy for what he goes through. He's happy all the time, and he was so sick before we started his biological injection. And now I definitely see a difference, but there's still always long-term effects in every autoinflammatory disease, unfortunately. So it's just rolling with the punches every day.
I mean, that's really the best that we can do, right? I mean, you're doing all the right things. It
Yeah.
just sucks when we want to be able to do more.
Yeah, it's just sad because, they're not the normal kids. We can go to like Hershey Park for a week or Disney World and have summer vacation. It's, hey, we have 5 appointments this week and 5 next week, and we're going to be admitted into the hospital to get your infusion this week, and you have a sleep study or EEG. Always something. Nobody gets a break.
I hate this for you. I just do.
Hey, they have a good mind. So I'm just like, maybe God blessed me with these kids because they know I can handle it. And my patience sometimes is thin because they're also the typical 4 and 2-year-old where they're crazy, painting on my walls, running down the street, throwing my cell phone in a toilet, just being menaces. But I love it. I love being a boy mom.
Yeah, I mean, there's nothing like it, right?
Oh gosh, I couldn't even imagine having another one. Jace is asking for a baby sister. I'm like, no way. No way. You got multiple personalities in your little toddler body. It's like having 12 of you around here. Absolutely not.
My gosh, I know. Our grandson he just turned 2, and wow. Whenever people are like, oh, at least you're still young to be able to have fun and play and all the things. And I'm like, yeah, that's true. But holy cow, I forgot how crazy they are.
My mom can only handle them for one day. She has RA too, so she's always in pain. And then they like destroy her whole house. And she's like, you need to come get your kids. I'm like, don't you love being a grandma? Like, keep them for a week. Give me a break.
Yeah, when my daughter and grandson are visiting, oh my gosh, we have this little tent for him in the living room. And he's like, Nana, Nana, come play in the tent. And I'm looking over at my husband and I'm like, get down here. Come on, Papa. You need to get on the floor. It's your turn. My back hurts. My hip hurts. Like, come on, your turn.
Exactly how my kids are. They make 4 to mom, and she's like, I don't know how I did this 23 years ago with you. Like, my sister is 14, and she's like, I'm just done.
I don't know how we do it either. We just do.
Oh,
We just do.
oh,
Sometimes we have no other choice. We just do the things we do because we have to.
definitely. I can't even imagine. I don't know how it's going to be like in 20 years when I have grandkids, or 30 years, or never. I hope never.
You're going to be just like you, but a little older.
Oh, so scary.
You're going to be the fun grandma, okay? I just know it. You will be. All right. I can't think of any other questions, but is there anything else we haven't talked about that you would like to bring up?
I don't think so. I mean, July is Juvenile Arthritis Month, so I hope everybody's supporting.
Yes, you better be. Get out there and show us how you're supporting. There's a challenge going on Instagram that myself and Make It Count for Danny are doing, where we're telling people to choose movement however they can. So you could do that if you want. Although I guess by the time people hear this episode, they won't. The challenge will be over. But choose movement anyway.
Hey, next year.
And
Next.
exactly. And just do your best to support everyone. Learn more, do more, get involved.
Definitely. Agreed. 100%. And being kind to each other. I mean, not everybody's illness is visible, so be nice.
Absolutely. And oh my gosh, I don't know about you, but I saw a post this morning from Cheryl, Arthritis Life Cheryl.
Mm-hmm.
Okay. If you didn't see it, go watch it. And she's talking about a message that she got from somebody saying that they have arthritis and it's not considered a chronic illness.
Well, whoever said that's lying.
And it's like, oh, what kind of arthritis do you have? Because there's many different kinds. There's like 100 different kinds.
Yeah.
And it is considered a chronic illness because anything that lasts longer than a year is considered a chronic illness.
People are so ignorant. Makes me mad.
Absolutely, 100%. Well, thank you for joining. It has been such a pleasure.
Of course.
And don't run away. I have to hit stop, but I still want you here anyway. So everyone, go follow Makenzie, join in her journey. She's a hoot and a half and so much fun to just talk to. So, all right, until next time, don't forget your spoon. The information, opinions, and recommendations presented in this podcast are for general information only. Consult your own physician for any medical issues that you may be having. The information should not be taken as a replacement for medical, clinical, professional advice, diagnoses, or medical intervention. My Spoonie sisters and guests will not be held liable for any of the consequences of such action or inaction. Trigger warning. Some episodes may cover sensitive topics including, but not limited to, suicide, abuse, mental illness, and chronic disease. You are advised to refrain from listening if you are likely to be offended or adversely impacted by any of these topics. None of the guests or hosts will be responsible for your use of the information contained therein. Life is not merely to be alive, but to be well. Living a life with a chronic illness is best described with one word: unpredictable. Be Well's products are designed to make the unpredictable easier to deal with. Back when I was getting my infusions, I would have loved to have their adult zip hoodie. They even have one in pink. They also have everything from one-day pill holders to urgency buckets. So remember, they want to make your life a little easier. So be sure to check out Be Well.